Hello and welcome back to the Guns and Glory show. I just got off the phone with the representative Bergman's office, well, the secretary for him, and I've spoken to this guy before. He seems pretty bright, and so does this representative. Contacted them on a couple of issues, and they've always been really good at calling me back. Well, this one was about our healthcare system in the Upper Peninsula. There's a couple of big problems with it. Now, this started in my doctor's office late last winter, early in the spring. I don't exactly remember when. I was in there, I said, "Hey, I got a problem." She said, "What's up?" I was like, "I hurt my back." She's like, "Yeah." I said, "Well, I messed it up really good putting this fence in, and I haven't been sleeping right. I've been getting like 2 hours of sleep at night. And only because I've been able to get a little bit of whiskey. And that's never been a problem for me. I didn't ever really drink before on a regular basis. I'd have one once in a while without a problem. And I was like, "Can you help me quit drinking?" She's like, "Well, how much you drinking?" And I said, "Well, every day, about 2 or 3 shots. But here's the thing, I was drinking it earlier and earlier in the afternoon. I would get the craving for it. So 7, 6, 5 o'clock for it. And then pretty soon it's like 3, I'm thinking I need to do something, because by 8 o'clock I'm asleep, not getting a whole lot done, and 2 in the morning I'm awake again. So around 2, another couple, 3 shots, and I'm drinking twice a day." She's like, "Okay." Gave me a little questionnaire, because she's, I guess, required to. I'm like, "All right." She's like, "Well, what do you want?" I said, "Well, I want to drink like I used to, just every now and then if I want to, not because I have to." She's like, "Well, that makes sense." And I was like, "Well, how much should I be able to drink without causing problems for myself, health-wise?" She said, "Well, about twice a week. I don't want you drinking any more than that, maybe no more than half a pint." I said, "Well, that's more than I drink at a given time anyway, so that's fine. Let's go for it." She's like, "Okay, I'll give you a couple of prescriptions. One of them's for anxiety, because you might have a little panic quitting, and one's for nausea, because that's a common side effect as well." I said, "Okay, thanks." And she said, "There are no treatment facilities anywhere in the Upper Peninsula for alcohol." And I was like, "Oh, well, that's not good, because they're everywhere downstate. And Michigan is supposed to be one state, not 2. And she said, "I know." I said, that's not good, because drinking is the most dangerous thing to quit." And she said, "I know, but I think you'll be all right with how much you're drinking, and with this, you'll be fine." I said, "Okay." I was a little nervous about it, but I went for it. And a few weeks later, I came back in. She said, "Well, what about drinking?" I said, "Good news. I'm fine." She gave me like 4 of these little pills for anxiety, and I used a couple of those, and well, she gave me 10. I used 4 of them, and just a couple of nausea pills, but I got it back under control. And now I'd have a couple of, maybe a double shot or half a pint on Friday. Usually I won't finish it up on Saturday, so I'm okay with that. And I said, "Well, I used to keep some anxiety meds in the house, just in case things got really bad. I don't like pills. I never have. But I'll use something if it's, appropriate." And probably twice a year. So she's like, "Well, I can't." And I was like, "Why?" I said, "Well, the Upper Peninsula healthcare plan won't allow me to prescribe you anything for anxiety or pain management if you smoke marijuana." And I said, "Well, that's stupid, because marijuana is legal here in Michigan, and recreationally and, medicinally." I said, "Well, if I were going to a doctor for, painkillers for the last 20 years, my liver and my kidneys would be shot." She's like, "Yeah. And, but they don't care about that. And it's federally legal." And I told the representative's office the same thing. I said, "Look, the 10th Amendment says if something's not in the Constitution, it's left to the people to decide, or the states. There's more to it than that, but that's what's relevant here. And so, since marijuana is not in the federal constitution, which it isn't, might have been written on it, there's some controversy with that, but then it's left to the states to decide, and we voted for it. You know, what we voted for here is irrelevant. The state of Michigan, the people voted. The state didn't really want it, and we got it anyway. So if this was a criminal thing where I wasn't following the law, I could understand that, maybe as an excuse from the insurance company, but I was like, you know what, I'll just go get it. I got other people I can go get it from. It's like, okay, that's fine. And I'm like, well, how much of that should I use, to be safe? And she told me. And I would never go outside of those parameters. I said, if you tell me this, I'll treat it exactly as though it was a prescription. So she did. Like, all right. I never wound up going to get any, but I might. I can. But, I've still got like 4 of those other left. And she said, besides, that particular one isn't really good for you. So I would have given you something else. And that's why I asked her. I said, what would you recommend? She recommended one, and that's what I would go get from my people. And I'm explaining all this to this representative, and he just didn't know. He thought when they called me back that I was expecting the insurance company to pay for it. And I said, no, that's not their responsibility at all, and that's not where I'm coming from. The law says I can grow it if I want to, and if I need to, I will. I wasn't expecting anybody. He's like, oh, thanks for clarifying. I said, well, thanks for calling me back. I really appreciated that, so that we can get this understood. And he said, well, I will pass this on to Mr. Bergman. He just doesn't think it's right either. I shouldn't have to, because she told me, the doctor told me that they won't treat me unless I actually take drug testing and prove that I'm not smoking weed. I'm like, oh, okay. I don't think so. She told me, I don't recommend that you stop smoking weed. From what I've seen in you, she's one of those people that didn't really believe in it. And I'm one of the people that she was like observing to see if she wanted to, she's just doing her own scientific method with her patients to help make up her mind. So I wanted to make a little video about that, give a little bit of credit to Representative Bergman, and give other people some encouragement to contact their elected officials and about issues that bother them, and let everybody know about some bullshit that's going on with our Upper Peninsula healthcare plan. Take care.